Beijing, the first thing Teresa Xu noticed at a maternity hospital in China's capital was how many couples and relatives were there. It was a sea of people, mostly women, accompanied by their worried husbands and parents, Xu says. Like many of the women, Xu was there to freeze her ovarian eggs. But unlike the others, she was unmarried and went alone, which didn't go over well. The doctor dismissively asked me, "Why not get a marriage license first?" She recalls. It was in November 2018, when she was 30 years old. The public hospital refused to have her eggs frozen, citing its rule allowing only married women to do so. Xu is suing the Beijing Obstetrics and Gynecology Hospital at Capital Medical University, arguing that no national law says a woman must be married to have the procedure. She filed suit in October 2019 and has gone to court hearings, but is still awaiting a decision. This is one of the more publicized examples of Chinese citizens challenging a system they say deprives them of public reproductive care and benefits because they're unmarried heterosexual women or LGBTQ people. Experts note that these restrictions persist even as China's leaders are now encouraging families to have more babies. It comes down to conservative values, and unmarried women who have children are usually found to have violated the catch-all legal rule of, quote, keeping up public order and moral lit. Last August, the government revised its laws to allow couples to have up to 3 children to boost the country's declining birth rate. That marked a big change. For 4 decades, China had a strict rule limiting most families to just 1 child. In addition to tormenting the population with brutal enforcement, the country wound up with a shrinking workforce and growing numbers of senior citizens. China raised the cap to 2 kids per family in 2016, but that did not revive the slowing population growth. The strict birth limits also led to a patchwork of different rules around the country that shut out non-traditional parents from social benefits and reproductive services. National public health care covers basic prenatal tests and delivery costs, but middle-class families often turn to private hospitals with higher out-of-pocket costs for more timely service. Different localities mandate non-traditional families pay all costs out of pocket, and may not guarantee new parents enjoy the same, lengthy maternity leave benefits traditional families enjoy. There are rules that say reproductive assistance services are only available to married couples, and while she points out unmarried men can freeze their sperm in China. To get around the restrictions, some unmarried people have taken matters into their own hands to have children.